Talk health. Talk wealth. Talk politics. Talk 1470 and 95.3 FM. WNN.
It's the Becky and Boca Show, coming to you live every Thursday night at 6 p.m. from glamorous downtown Boca Raton. So sit back, relax, and let me show you how to indulge yourself Boca style. Hello, and welcome to the Becky and Boca Show. Tonight, I have a very interesting guest that I've wanted to get in here for a long time. This is Dr. Steve Fagien. And one of the reasons I wanted to bring him in is that he did my upper eyelids. I think it was about 18 months ago. And I did a video and put it on YouTube of the progression from right after the surgery to 2 weeks out. And I got so many views on that and so many people commenting on it because it was a lot easier than people think. So, Dr. Fagien, I'd like to introduce you. First of all, tell me your credentials. I downloaded your CV, and it took up all of the paper in my printer.
Well,
so, what's your easiest title to?
Well, first of all, Becky, thank you for having me on your show. It's been a long time coming. I know we've been trying to get together to do this.
Yeah, you travel a lot,
and you've been terrific, and you're a model patient, so it was really easy. My title is Oculoplastic Surgery. I trained in ophthalmology first, and then I did plastic surgery afterwards. So I specialize just in cosmetic eyelid surgery.
So you're a plastic surgeon for the eyes?
Just for the eyes.
Okay.
And people come to me and they say, well, can you do other things? And I stick just to eyes.
But you're also an ophthalmologist.
Right. So I trained in ophthalmology first, but I don't practice general ophthalmology.
Okay. Did you do any ophthalmology surgery or?
I did in my training, but I never did any ophthalmology or eye surgery in my practice. So I limited everything, and I've been in Boca, hard to believe, 30 years now.
Oh, I know.
I remember when we got here.
I've been here almost as long.
I know. So it's hard to believe. I raised my children here in Boca Raton, so it seems like it went in a flash. But that's what I do. I do oculoplastic surgery.
And you are definitely the go-to guy for eyes around here.
Well, that's nice to hear.
You're the best. And what surprised me, I waited so long to do my upper eyelids. They were drooping almost right down to the top, and I kept dreading it, thinking this is going to be some horrible thing. I'm gonna have to hide for a couple of weeks. Yeah. And it was so easy. I know it's because of the talent of the surgeon.
And it can be, and I think most people that do eyelid surgery, there's others that do eyelid surgery. It's of all the things we do in plastic surgery, it's probably the easiest tolerated.
Well, I did the uppers. Some people have to do the uppers and lowers.
And lowers are not quite as easy, but they can be.
They
can be pretty close. I tell patients to come to see me for their upper eyelids, besides telling them exactly what to expect in the course and the result and when they're going to look good and presentable, that there's really little pain, and most of them look at me and go, yeah, right, of course you're going to say that. And then they go through the procedure just like you did, and they go, I can't believe it. I really don't have a day of pain.
There was no pain. There were no bandages, no drains, nothing.
No. And upper eyelids are pretty...
I was at Publix later that day.
Yeah. I've actually been out to restaurants the evening I've done surgery and seen patients of mine that just had surgery that day out.
Oh, yeah.
So it happens. And
restaurants are dark. You can do that.
Yeah, and they with little sunglasses, and they're wondering why
the only thing that slowed me down at all was that I couldn't wear makeup for a period of, I don't know.
Couple weeks.
Yeah. So they got red for a few days. But during the day, it was no problem. Sunglasses. We're in Florida. I went everywhere.
And, it used to be 30 years ago, it was a secret when you had surgery.
Yeah.
And people wouldn't tell their friends. They would hide out.
That's totally changing.
That has completely changed. And people are actually somewhat proud of their surgery.
Yeah,
it's like a status symbol to have cosmetic surgery. So it's time to change. And it's not only changed here in the U.S. I travel, and we'll talk about this, I'm sure, later. I travel quite a bit and teach in almost every continent in the world. And it's becoming... And the whole attitude has changed even in Europe.
That's interesting, because I thought maybe it was just like Boca Raton and South Florida. Since there's so much of it that people just are used to.
There is a lot, and we tend to have probably more cosmetic surgery in certain pockets in the U.S., New York, South Florida, Dallas, L.A., Chicago. But now, even internationally, you're seeing areas that wouldn't even consider plastic surgery, much like conservative places like Boston in the U.S., where they are really into it now. In fact, into it with a vengeance. It's like now that they've avoided it all these years, they're very interested about it and very proud of it.
And has it gotten easier for the patient? I know there's difference in anesthesia now than traditionally.
It has. One of the things, exactly right, to your point, anesthesia with certain drugs that are used, like Propofol, which is always the fear
I think that's
drug.
what used on me.
And it's the drug that Michael Jackson, unfortunately.
Everybody's scared of it for that reason, but
right,
I know it's a very good drug.
And used appropriately, it is probably one of the best advances in IV sedation. But it's not a drug you take at home.
Right.
So it is an excellent drug. You have an amazing sleep. You wake up feeling fine and rested.
I felt great after the surgery.
It's
like I
very
said, I
common.
went grocery shopping.
Yeah.
You know, it wasn't, there was no feeling bad.
There's no hangover.
Right.
You know, so it's an excellent drug. And again, used in the right setting by the right people, it's a very safe drug. So we hear all these horror stories that happen, which are unfortunate accidents. But that should never happen in a controlled setting.
Nobody should be doing Propofol in their bedroom with
No, you don't do it at home.
cardiologist.
Administered by anyone. It's not. You need to be appropriately monitored, and that's the way I do the surgery, as you experience. So,
do you do any eyes with general anesthesia, or is
no.
it all? Okay.
You know, every once in a while you get a patient and say, "I have to have general anesthesia." Or they
Why
say,
is that?
well, they'll say they've tried IV sedation, and I never go out completely, and I hear and feel everything.
They're afraid they're going to. Okay.
Right, and
they're not going to be able to tell you.
And I will tell you, I've had many of those patients have IV sedation, and they don't hear or feel or remember
so
anything.
what do you think happened with they got this?
Well, they may have
anecdote?
lightly sedated them with maybe a drug that wasn't as effective as
Wasn't the same
Propofol.
drug,
And there are some very good drugs with the short acting. So they may have worn off their effect, and then they wake up. But usually they don't wake up and they're in pain. But that fear, they want to have general anesthesia.
But even if they were in pain, wouldn't the doctor recognize that right away and
yes,
and take care of the
yeah,
problem?
but you know, you have to understand some patients' fears, and so I spend a lot of time with them in consultation and get a good idea of what they want, not only surgically but how they're going to do as a patient through the entire process. So you have to get to know your patient.
Do you think is it better not to use general anesthesia? Is there any reason that one is better than the other?
Yeah, I think even general anesthesia is very safe these days.
It's a controlled environment. And
it's
monitored,
controlled,
so.
But it's not as safe as IV sedation. I mean, if you look statistically of where events happen with anesthesia, it's almost never with IV sedation. They're always always with general anesthesia.
Okay.
So
people do always say they don't want general anesthesia. I was just wondering if there's a reason.
And that's why they've heard of or read about a problem with general anesthesia where, you know, am I going to wake up and things like that. And of course, that rarely happens. There's lottery odds that those things would happen. But the safety comparison between IV sedation and general anesthesia, IV sedation is simply safer.
Okay, that's good to know. So you do
all IV
surgeries
sedation. If somebody tells me they need general, we either have a conversation and we discuss the fact that I only do IV sedation, or, you know, every once in a while, once a year, somebody goes, if I can't have general anesthesia, I'm not going to do my surgery. And I say, you know what, I don't think you should then. If you're really that concerned, then wait. And if
I wouldn't even want the doctor to do something that he doesn't normally do.
And that is a good way to look at it. Yet some people, they have an idea of exactly how they want it.
Yeah.
They want to control the situation.
They want to be knocked out and wake up and it's done.
And what happens is, usually if you let a patient dictate what they believe is what's best, when you believe it's not, you need to back up and say, you know what, maybe this isn't a right fit.
Oh, that's true with you because you don't go overboard on people like a lot of doctors do.
You know,
and I know patients always want more.
They do, and you know, it's kind of your stamp of approval. So
they're walking around saying that.
Yeah, and I don't want for just trying to be the right guy for the right patient. I don't want to be that person that just, you know, in order to just get more business, you're doing more procedures. I want my patients to be happy. I want them to enjoy the experience, and the experience has a lot to do with it.
Right.
You know, our staff is superb. So, you know, we make sure that not only the surgery goes well, but that their experience from the time they walk into the office, by the time they're done. Thank you. Yeah. And we work hard at it, and it's very important to me. I want them to be happy with their whole experience.
A good experience.
And, you know, we'll talk about this, I'm sure. I don't just do eyelid surgery, so I do a lot of injectables.
Right,
So,
yeah, I go to you for that.
Yeah, so the experience is very important. You know, pain control. Sure. Patients can painlessly get procedures, so a lot of them are needle phobes where they're really concerned.
That's funny. People that I know that don't do injectables, and that would be nobody in Boca Raton, but people like in Chicago and stuff, they're afraid of the needles.
Oh, sure they are.
Say, I don't want the pain.
And I understand that. And it's completely reasonable to be fearful of needles. A lot of people are, but there are certain ways you can deliver injectables, whether it's Botox or Botox-like
Well, you
drugs.
do a dental block on me when you do
when I do fillers.
lips and fillers.
For most people, except for there are those patients that when they go to the dentist, they don't want anesthesia. They just go straight, which is
Who's that?
There's a few, and I have a few in my practice. They don't want any local. But you can give a very quick, effective, almost painless block of anesthesia, like at a dentist's office. That's what we call it, a dental block, where they don't experience not only discomfort, but it reduces the bruising. So patients not only want to not feel it, they want to get back into the world within a day. So if they're all beat up and they had a painful experience, it's not a win-win.
Right.
So the experience is very important to me. But you know, for eyelid surgery, you're mentioning upper eyelids. The lower eyelids are at times a little more complicated. It doesn't mean risky or dangerous, but there's more to the lower eyelids that make certain patients have some level of mild discomfort, but never pain.
Okay.
And so there's many ways that I do lower eyelids, and even for upper eyelids, I've written a lot. And I know you mentioned my CV, but I write a lot in the peer-reviewed journals. Particularly, I'm an editor, and I write a lot for Plastic and Reconstructive Surgery. It's the largest plastic surgery journal in the world, most revered as well. And I'm one of the editors. But before I even became an editor, I wrote a lot of peer-reviewed articles about my thoughts and concepts of upper and lower eyelid surgery. So it's changed. And it's changed dramatically.
You think it's gotten easier for the patient?
I do. I think the surgery is better now than it used to be, and I think it'll be better in 10 years. I think some of the things we do today, we'll look in 10 years and say, really, we did it that way?
I know. I was putting it off for years, and once I did it, I was like,
yeah, well,
wait.
And there's some advantages. I mean, some people actually benefit from advanced techniques and technology. So I remember I actually did the eyes of my mentor in plastic surgery. And when I was going over the procedures with him, as I do with any patient, but again, one of the things you don't want to do is you have to treat even your friends, loved ones, mentors, you treat them like a patient, because if you don't, things happen. So came in for his pre-op, we're talking about how we're going to do the procedure. He goes, well, I didn't teach you that. And I said, yeah, I know. And he goes, and I go, well, lower lids, what are you going to do? I said, well, and I explained I developed a procedure called retinacular suspension. He goes, we never did that. And I said, yes, I know. So I think some of the better surgeons have adopted what they've learned in training and developed better techniques that give better results. Because, like you said, patients want results, but they also don't want to look like they've had surgery.
Right.
So, and which is, people say, well, that should be, it's not that easy. Whether it's a facelift or a rhinoplasty or having your ears done or your eyes, to get a great result and have patients not look like they've had surgery takes next level techniques and understanding.
Well, your eyelids look very natural, and I think you were explaining to me the difference between, like, a lot of people want those Hollywood big, huge lids.
Yeah, and that was a fad. And, you know, I've given a lecture for years, you know, Marlene Dietrich, Marilyn Monroe. They actually had true lid ptosis or droopy bedroom eyes. And so that became the fad. Everybody wanted to have those very deep eyes with a high sulcus where you had an inch to put makeup on. Yeah. And in some people that looks okay. In most people it does not. And if you look at some of the most beautiful fashion models, they all have very low folds. They have very firm, tight skin and muscle. But their folds, they don't have an inch to put makeup on. But somehow, as we get older, we believe that's what we want because that's what we think of. We see hanging skin.
I've even talked to people recently that say they want that.
Yeah, and they do. And yet, when you show them the differences, and there's some people they insist on that, and you can deliver that surgically. But I think most people look like you take a few years back and you make them look like they used to look, rather than making them look like something they never looked like.
Completely different. Yeah.
So you know, you don't want to change people. You'd like to really take back a few years. And I think most patients are very happy with that.
Well, tell us about your practice. You're on Glades Road.
Glades Road, across from FAU at the Boca Raton Regional Hospital, Building 660 Glades.
Very conveniently located.
It's a good place, great parking
right
garage.
On
I parked
Road,
there.
Right near I-95, right near the hospital. Thank you. You have been watching and listening to The Becky and Boca Show. Tune in every Thursday night at 6 p.m. to discover all the ways to spoil yourself and have a good time in beautiful Boca Raton. See you next week.
The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and